So first of all, we're talking about corrective care. We have to distinguish what that is compared to just traditional chiropractic care. And I think one of the great things about corrective care and what sets it apart is it's predictable. The results are predictable, it's reproducible, and they're measurable. One of the things I distinguish with patients when they come in is, first of all, what's the goal of care? Is it just to get out of pain, or do we want to fix what's going on? What's the long-term goal of people? People come to see me, I'm always thinking, what am I actually going to do for this patient that's going to make a difference for them long-term in their life? And when most people come in, they have some initial complaint or problem we definitely want to handle. But beyond that, we want to know, well, why did this happen in the first place? And what are we going to do to actually address and correct why it happened? And then more importantly, once it's actually fixed or corrected, what are we going to do to show the patient how to keep this healthy or keep this fixed so it doesn't happen again? I do something called chiropractic biophysics. It's the most researched chiropractic and actually corrective technique out there. And there's a whole different level of knowledge and evaluation that goes on with the patient. And it's everything we do is very clear and it's very cut and dry, and what's going on and how we're actually going to go about correcting it. It's not just adjustments. It involves doing some rehab in the office before you get adjusted to get the spine properly loosened up so that the adjustments go better. And then afterwards, we actually do specific rehab to fully correct and restore all the tissues that hold the spine together back to normal. Once something's corrected, that's when we maintain it. Most people are interested in maintenance or wellness, but a way to look at it is, well, what do you want to maintain? Do you just want to get something where there's a little less pain and maintain it when it's still, not fixed? Or do you actually want to correct something and then once it's fully corrected, maintain that? Well, the kind of care we do is very predictable because through all the research, we know what different kinds of spinal problems, we know which kinds of rehab, which kind of adjustments, which kind of therapies or traction will work best for each individual problem. And it's measurable in the sense that, if we're going to measure posture, we take a pre and post posture evaluation that the patient can actually see what's changed. If we have to do an x-ray, we can take a pre and post x-ray with a very high-tech digital analysis that gives the patient a report that shows them exactly how much change has actually happened. So when we're starting off, it's like, well, here's where we're at, here's where we're going to get to, here's what we're measuring to know that we've gotten there. And then once we get it there, this is what you, the patient, has to do to keep it there.